Hi, this is Bedrest Coach Darline Turner-Lee, owner and founder of Mamas on Bedrest and Beyond. Today we're talking about the Supreme Court ruling is coming, folks. It's coming tomorrow on whether or not the Affordable Care Act is constitutional. I don't know, if you haven't heard about the whole brouhaha surrounding the Affordable Care Act, you have to have been living under a rock, at least if you're in the U.S. Just to kind of recap, as you know, unlike many countries, the United States does not have a national health care plan. So everyone has varying insurances from varying insurance companies. And as many of you know and have experienced, insurance policies in the US can be very comprehensive and cover most anything, or they can cover almost nothing, and you pay so much out of pocket that it's almost not worth having them. It's been a real problem over the years because the United States pays the most of any industrial country for its health care, and in a lot of ways, in most ways especially, we get the least amount of coverage. So when President Obama came in, one of his whole pieces of his election campaign was that he was going to get health care in. And over the first couple years of his presidency, it was just a big mess. Everybody was arguing in Congress. He wanted a single payer system. People didn't want that, blah, 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 blah. They ended up passing the Affordable Care Act, which has some good tenets. It enables some 35 million people to be insured. It doesn't cover everyone who is uninsured, but 35 million is still a pretty good number. And yet everybody has complained because there has been this individual mandate that everyone has to buy an insurance policy or be fined. And so this is what many states are taking to court, saying that, we can't be responsible for insuring everyone and we can't enforce this mandate. It's going to be too much on our economies, blah, 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 blah. Everybody's been arguing it. It's been back and forth in the courts. Finally, the Supreme Court is going to argue this case tomorrow, or at least that's what's been projected. They are supposed to be arguing this case tomorrow. Tomorrow is the last day of this session, the 2011-2012 session, and then the justices go home for the summer. So it's going to be a really rockin', rootin' tootin' type of thing, and I am watching it on bated breath because the Affordable Care Act, it is not perfect. I personally would have liked to have had a single payer system, but that's a whole nother situation. But it did and does provide for some really good things for mamas and for their children. And because of that, I really don't hope that it is repealed, because if part of it is repealed or the whole thing is repealed, it's going to be a hot mess just in and of itself. A lot of people are looking at it from the political standpoint of this is going to be a big blow to President Obama's presidency, blah, blah, blah. That I can't really speak to. I am not a political scientist. I'm not a political analyst. But I look at it from the standpoint of, if 35 million people now have access to health insurance that didn't, if this law is repealed, these people will not have access to health care, and many more people will probably again be without health care. In particular, as always, I look at how this affects mamas and babies. And currently, what the Affordable Care Act does provide is preventive screening services. Now, most of us are thinking, well, of course, if moms are getting prenatal care, they're getting their preventive screening services. Well, unfortunately, a lot of mamas were not covered for prenatal care, so they're not getting their preventive screening services. And if they're not being screened for iron deficiency anemia, for hepatitis B, for their Rh compatibility, and for other things, their pregnancies are at risk. So for mamas who have not been previously covered and who are now covered and receiving these services, this is potentially life-saving medical treatment for them and for their babies. The way the Affordable Care Act is set up right now, employers must provide breaks and stations for nursing mothers. This has been a huge issue. I mean, I've heard countless stories of women in supply closets, in bathroom stalls, out in their cars, what have you, trying to pump milk for their babies because they've gone back to work. It's really not that difficult to supply a small conference room or an office that's not being used, what have you, that can be quiet, comfortable, and private for a mama to be able to nurse. And again, to provide breaks. Now, people say, well, how come she's getting all these mini breaks? honestly, if you're using a breast pump, it takes all of about 10 minutes if it's a dual pump to pump your breast. It's not that big a deal. And a lot of women can do paperwork at the same time. I remember working for a doctor, and she used to write her charts while she was pumping milk. So it's not like you're going to lose all that much productivity. But again, the Affordable Care Act says this must be included. You must provide this as an employer, which I don't think is such a bad deal. The Affordable Care Act provides well baby and well child checkups without out-of-pocket costs. This is something else I am a huge proponent of, because people complain, well, I don't get my child immunized because I can't afford it. Well, or we have these outbreaks of measles, mumps, rubella, what have you. If we can have well child and well baby checks, then we can prevent a lot of things that are coming. We can prevent instances of croup. We can prevent instances of measles, mumps, rubella, because children are immunized if children get sick, or we can do the preventive screenings so that they don't get sick. And if they're going to childcare, they're not spreading it to all the other children. Medicare patients and Medicare eligible patients will then get free well visits. And this is huge. A lot of people say, well, how come they're getting free visits? Blah, blah, blah. When people are uninsured and they get something as simple as an earache, what do? They go to the emergency room. To walk through the emergency room doors is anywhere from $400 to $500. This is before you're checked in, before someone so much as takes your temperature. When someone is uninsured and they don't have money, the hospital eats that cost and it passes it on to those of us who are insured. If people who are Medicare eligible can go somewhere where they can get well visits and care without going to the emergency room, this is going to be a significant cost savings for all of us. Now, as it comes back to mamas, if you want to go back to, I'm not saying want to, if you go back to and check out our blog post on June 11th, which was what to expect with insurance when you're expecting, and June 15th, what you need to know about short-term disability. Many of you know from personal experience and from those blog posts that getting health care coverage when you're pregnant or maintaining it while you're pregnant can be difficult. Many healthcare policies do not have riders for pregnancy, which I'm kind of like, what the heck is that? But anyway, they don't have rider. You have to purchase an additional rider. Pregnancy and prenatal visits are not covered. And if you take a job or you become pregnant, there have been companies that have dropped women, or who, if a woman's been working for a company in that probationary period and she becomes pregnant, they've been able to deny her coverage. With the Affordable Care Act, this no longer is happening. A woman cannot be denied coverage because she's pregnant, or essentially because she's female, because she might get pregnant. And this was huge. A lot of people don't like it. They feel that it's unfair. Women are getting an unfair advantage. But the reality is women make the children that create the rest of the population. So we need to take care of the population. My personal opinion, nobody else's. It also provides that you cannot deny coverage for women who have children with special needs. Now, this is really important to mamas on Bedrest, because, like it or not, we are more likely to have children who are preterm infants, premature infants, and have long-standing health needs. And I have seen babies born and within a week they're uninsured. And anybody who's had a child in the NICU knows those costs add up quickly. NICU visits, when I say NICU admissions are somewhere around $1,000 a day at some hospitals. And if your child is in the NICU 60 days, you do the math. That's just for them being in there. We're not talking about the monitoring, the care, the medications, the treatments they get. I have a friend who had a child who was in the NICU for 65 days, and when that child went home, they had $1 million hospital bill. Just unbelievable. And imagine when you have a child like that, a lot of policies don't want to cover that child, because a preterm infant at, say, 26 weeks, we know is going to have long-standing health and developmental issues. They're going to need speech therapy, occupational therapy, physical therapy, possibly learning things in school, glasses, braces, whatever. Lots and lots of care, and not just when the child leaves the NICU, for the duration of that child's life. And a lot of insurance companies look at that and go, heck no, we're not paying for it. The Affordable Care Act says, yes, you are, and includes vision and dental in the policy. So this is awesome. And they can't cancel the policy because of this baby. Starting in 2014, prenatal coverage has to be included in all employee health plans. and you can't deny the plan to the women, and you can't deny their coverage, and you can't jack up the price, which I always thought was just so poetic, because here we are women, because we may get pregnant, our premiums were higher. What is that? So anyway, this is what so far the Affordable Care Act is actually providing for us as women, as mamas, as potential high-risk pregnant mamas, and for our babies. This is what we are getting as a result of that legislation. And there are a lot of people who don't want it. They don't want to have to pay that. They don't think it's fair, not just for this, but for the Affordable Care Act in general. They don't want it. They don't want government mandated healthcare. They don't want government run healthcare, although many of the people opposing it are on Medicare. Medicare is government run healthcare. The legislators who are arguing it have government paid healthcare. Our people. President Obama has government paid healthcare. Everyone in Congress has government paid healthcare and will have it for life. So my kind of take on that is, why can't we have the insurance you've got? Okay, that's just me. But anyway, the Supreme Court is going to rule on this, whether or not the Affordable Care Act is constitutional, whether parts of it are constitutional, or what have you. It's going to be big, and we will be talking about this again in our next session after the vote happens and we see what happens. But what are the possible outcomes? And I'm going to read this because otherwise I'm probably going to jack it up. Most observers agree that there are 5 possible outcomes for the decision. The first one is to strike down the individual mandate that requires Americans to buy health insurance or to pay a penalty as unconstitutional, but to uphold the rest of the law. Most or many people view this as the most likely outcome. So that's number 1. Number 2, strike down the individual mandate, as well as 2 insurance reforms considered inseparable from the individual mandate, which are the guaranteed issue of health insurance coverage and community rating for premiums. Okay, I'm not exactly sure what all that is. Okay, so let me try that again. So the number 2 potential outcome is strike down the individual mandate, as well as 2 insurance reforms considered inseparable from the individual mandate. First being guaranteed issue of health insurance coverage, meaning that insurers cannot deny anyone coverage on the basis of pre-existing conditions. Oh, okay, there we go. And the second part of that, community rating for premiums. This would keep insurers from charging high rates because of pre-existing conditions. Okay, so they're trying to get that struck down along with the individual mandates. So you can see insurance companies, they got a lot at stake here. The third potential outcome, strike down the entire law. This would happen if the court deems the individual mandate unconstitutional and cannot be separated from the rest of the Affordable Care Act, known as the severability issue. Okay, so if they feel like you can't just strike down whether or not the individual mandate is constitutional, what have you, they can just scrap the whole thing. Ooh. Option 4, uphold the individual mandate but strike down the dramatic expansion of the Medicaid program as unconstitutional. Okay, so they can say we can uphold the individual mandate but we won't expand Medicaid. I'm not sure where that would really come in, but that's one option. And the final option is to uphold the entire law. Most observers consider this in the fourth scenario to be the least likely, especially in the wake of Justice Ginsburg's recent comments and discussions during oral arguments in March. Now I have to go back and look at her comments because I haven't seen them, but I will actually put links to those on the summary of this video so that you can see. But it's really an interesting process because according to this, and I'm pulling this from Medscape, this is just kind of a summary, a decision upholding the entire law would be a major victory for Democrats and President Obama. And quite frankly, I think for individuals who are without health insurance right now and for women. A decision against part or all of the law would not only be a major blow to Democrats and President Obama, but also ratchet up pressure on Republicans to come up with their own legislation to deal with the growing healthcare crisis. If the law is allowed to stand in part or in whole, Republican Presidential candidate Mitt Romney and GOP congressional leaders have indicated that they would repeal the Affordable Care Act if they get control of Congress and the White House in the November elections. So, I mean, it's really interesting to look at. There is a lot at stake. I mean, this article I pulled off of Medscape really is looking at things in terms of how this is going to play out politically. Personally, I don't care. I mean, I do in terms of whether or not the law is upheld, but how it affects, the president's presidency. Yeah, I mean, he's a big boy. He can handle himself. I'm more concerned with the fact that I don't want to see people without health care, because we know what happens when people don't have health care. Everybody suffers. They suffer from the standpoint of people who use and abuse the emergency care system just for, routine things such as an earache or a cold. We see it in higher costs for those of us who are insured, because inadvertently we end up having to cover for uninsured people, because you cannot deny someone health care if they're sick, because if we do that, their illness spreads. We know that children who are not vaccinated, children who do not have health care and get ill, and their parents who are working hard, and I have nothing against people who are working hard, but feel they can't take time off of work, send their children to daycare. And when your child is in daycare with these children who are not getting the care they need, that means your child's going to get sick. It's just that plain and simple. These are the same children who may be going to school with your children. They're coming in with strep throat. Your child may come down with strep throat. They're coming in, they haven't been immunized for various things, chicken pox, what have you. Your child is at risk. So, I mean, it just makes sense. Make health care and preventive treatments and everything affordable and available. It's a lot cheaper to immunize kids than to try and treat the illnesses later, or an epidemic that comes out. We know measles, mumps, rubella, they're all on the rise because people aren't getting immunized. They aren't getting the treatments that they need. We're seeing it in college campuses. We're seeing it in daycares. We're seeing it in places and people of close proximity. It's happening, people, and it's not going to get better. We need to take care of our citizenship, and I believe providing health care is one way to do it. Again, this is my opinion. A lot of people can disagree with me. You can write nasty comments on this vlog. That's up to you. But we have to do something. Our healthcare costs in the United States are just out of hand. It could literally bankrupt the country at some point. Hopefully not anytime soon. But the reality is, probably in my life and most certainly in my children's lifetime, people keep saying, well, we can't leave these debts for our children. We need to leave our children with a healthy country, a healthy citizenship, and be able to be healthy citizens themselves. And I see that only as a possibility if our children all have access to health care. So this is going to be interesting. Tomorrow is going to be a really big day in the Supreme Court. I'm going to be watching. I think everybody's going to be watching. And if you don't want to watch, don't worry about it, because I'm going to be talking about it in our next post. So I'll do my best to keep you informed and let you know what comes up. But for now, this is Darline Turner-Lee, Bedrest Coach, owner and founder of Mamas on Bedrest and Beyond. We'll keep you up on what's going on in the Supreme Court. Take care. Bye-bye.